My name's Logan, and I've decided to have PRP today to try and help increase the range of movement in my knee and relieve some of the pain. I damaged my knee when I was snowboarding 7 years ago, and since then I've lost the range of movement in my knee and it's felt quite creaky.
My name is Dr. Sarah Tonks. I am an aesthetic doctor and I also practice health and wellness therapies. I offer lots of different types of treatments. Varies from those who are concerned about their appearance, so I do things like thread lifting, chemical peels, dermal fillers. I like to make a subliminal change to the way that people look, but I also offer more health and wellness type procedures. So I do quite a lot of PRP for sports injuries, people with osteoarthritis. I also look at nutritional testing, IV vitamin therapies, pretty much a whole range of things. So first we're going to take some blood from Logan, just from the arm, as you would when you're having a normal blood test. We spin that down in a centrifuge to separate the platelet-rich plasma. Once we have that, then we're going to re-inject that back into the knee joint, which is where his injury is. It's used by the Ministry of Defence in people who have been injured during a battle. It's also used aesthetically in the face. You can use it to refresh the skin, and you can also use it in sports therapy and for patients with osteoarthritis to help reduce the inflammation in the joints and also to promote healing.
So I had the first treatment and that was completely pain-free despite my apprehensions. The next day it started feeling better. It started feeling looser and sturdier at the same time.
After the PRP, some clients will see a modest improvement immediately. However, it quite often takes maybe 2 or 3 before you start seeing the maximum benefit. Because it's a natural treatment, there's no upper limit to how many you can have. So if you're finding that it's beneficial, you could keep having it if you wanted to.
Well, I first heard about PRP a few years back when Freddie Flintoff had it in his knee and Tiger Woods had some in his back. They'd had it for repetitive sports injuries and they had great results, so I wanted to try it myself. The treatment went really well and I'm really happy with the results. The actual longest part of the treatment was doing the blood separation. I would recommend this treatment to other people with sports injuries, especially if you've been doing physiotherapy treatment for some time. PRP really complements that well and aids you in obtaining better range of movement. The best thing about this treatment really is that I've just come back from holiday and I've been mono-skiing. And a few years ago I wouldn't have thought I'd be able to do that. I've always been really hesitant of doing anything like that since my accident, and as well as the improvements I've seen, it's also given me the confidence to go back and start doing sports that I enjoy and trying out new ones.
It's very, very satisfying. And hearing some of the stories about people who have gone on to compete at various different levels in sports after having the treatment, it really does make it all worthwhile for me.